Neeraja, you'll be speaking on comparison of visual outcomes of traumatic optic neuropathy, patient with and without intervention.
Shall I start?
Yeah, please carry on.
Okay. Good morning. I'm Dr. Neeraja and VARMA, DNB resident from Neeraja Super Specialty Eye Hospital. So I'll be presenting regarding comparison of visual outcomes of patients with traumatic optic neuropathy with and without intervention. So TON is the most common cause of visual loss after blunt trauma to the head, and management of TON is still variable and no consensus has been made regarding any set guidelines as how to treat. So currently accepted management include observation, oral IV corticosteroids, surgery, or just a combination of both. So the purpose of my study was to compare the visual outcomes in patients with TON who receive different treatment modalities and to analyze the predictors of visual outcomes, the prognostic factors good and bad. So it's a retrospective study and all patients who are diagnosed with TON at first presentation were included, and those who have completed the treatment with final BCVA, that is after 6 weeks. So the study period was 5 years, and all patients within this 5-year period was taken, and the demographic details, time of presentation, treatment given, visual acuity before and after treatment were taken. So out of the total 96 patients in 5 years, only 46 patients completed the treatment and the final BCVA recordings were taken. So all those who were fit for IVMP were given all the 3 doses of 1 gram per day, followed by a short course of oral steroids. And those not fit for IVMP were just given the oral steroids. So out of the total sample of 46 patients, majority 29 were given just observation, while 7 were given IVMP and 10 were given oral steroids. So the results were that 37% of patients showed improvement in visual acuity. And out of the people who were given IVMP, 100% were improved by 2 lines or more. And see, in IVMP, 2 lines or more were improved in all patients, all 7. While oral steroids, most showed no improvement, while about 30% improved by 1 line and around the same 30% improved by 2 lines or more. While nil intervention, majority more than 80% did not improve, and very few patients, we had 2 patients who improved by 6 lines. So the conclusion was that people who were given IVMP invariably showed good visual improvement as compared to oral steroids and nil intervention, of course. And PL negative is a poor prognostic factor for visual outcomes. And we had also analyzed the good and bad prognostic factors. So early presentation, early initiation of treatment, completion of treatment, and good visual acuity at the time of presentation were good prognostic factors. So the limitations were that it was a retrospective study, there was no randomization, and the lacunae in data in view of retrospective data collection. A lot of the timings were not recorded in the patients, the duration of trauma, how long back the trauma happened was not documented. And the variable sample size in the treatment group is because we had included the treatment from different specialties. The doctors, how they treated were different, and they, based on the timing, a lot of people were not able to intervene. So that is my study. Thank you.
So I had a question. You mentioned that duration between the trauma to presentation was not calculated. Any prior treatment before presentation, was that included? Because a lot of times traumatic optic neuropathy has received steroids somewhere else and come,
Yes.
and then they again receive steroids. So was that documented?
No, sir. It was a retrospective study. If there were any documented treatment given, we had excluded them.
And any mean presenting vision? You mentioned in the conclusion that poor presenting vision or poor was associated with, worse outcomes. But how many of them were PL negative? Because I think in the, if you probably list the presenting vision in the observation group, probably a high percentage of them would have been no
sir,
PL.
yes, sir.
So unless you show that information, it masks a lot of things. Because here you would see that, you would say that steroids have to be given in every case, but ONTT and CRASH both have shown that megadose steroids actually cause more harm than benefit. So.
Yes,
And at the same time, for oral steroid patients, compliance also. So you never
Yes,
know
they're
how
actually
much they
taking
have
it.
completed or not.
Yes. Thank you.
Thank you.